Alright, chapter 28 goes over anemias. So hopefully we can kind of help you understand this a little bit better. It gets real confusing though, for sure. So basically, you know that polycythemia is too many, anemia is too few. So just kind of be aware of that. Anemia is defined as the total number of red blood cells is either low or low quality. Okay. So you can have macrocytic, which is large, microcytic, small, or normocytic. So you can look at these different terms and they'll help you to sort out which sort of anemia you're dealing with. Okay. And then chromic has to do with the amount of chromin, which has to do with color. So you either get normochromic or hypochromic. So those are kind of the pale looking cells, okay? Anocytosis is that there's various sizes. And poikilocytosis, I'm guessing I'm pronouncing that right, is in various shapes. So anocytosis size, poikilocytosis is shapes. Okay, so you can have sickling or crescent shapes, that sort of thing. So basically the treatment for any kind of anemia is to figure out what kind of anemia and to treat the underlying cause. Macrocytic normochromic anemias, okay, are termed megablastic anemias. The RBCs are large, so just kind of be aware of that if you're looking at. So these, these get to do with your B12 or your folate deficiencies. So just kind of be aware of if you see macrocytosis on your CBC report, be aware that you're probably looking at either a folic acid or a vitamin B12 deficiency. Pernicious anemia, which is vitamin B12, is the most common. Okay, and we see this a lot in older people. Excuse me. Here's the cell that kind of looks at that. You see these large cells, but their color is about the same as a normal cell. It goes through some of the symptoms for pernicious anemia. And the treatment, of course, is to replace it. And this is pernicious anemia continued. And then the other sort is the folic acid anemias, okay? And you're going to want to sort that out as well. Now, most of us, if we saw something like this and we were unsure, we're going to get a second opinion from the pathologist or from a hematologist and look at the symptoms. This, depending on what kind of practice you're in, you may or may not want to treat this. This may be something that you see commonly and you treat. Pernicious anemia for sure is pretty common, or you may want to get a definitive diagnosis then treat, but that's going to depend on the practice you're in and your comfort level. Okay. So when you look at the microcytic hypochromic anemias, then you're looking at, you get to look at these small pale cells. Okay, the most common disorder here is the iron deficiency anemias, and this one can be related to inadequate dietary intake, excessive loss. The most common in non-menstruating people or adults is GI loss. Chronic parasites could be an issue, not necessarily so much for us here in the United States. And so this kind of tells you, and this has got some various sizes as well. But you've got these, and these cells don't look particularly smaller, but they're, various sizes, and they're very pale looking. So when you think about GI bleeds, you want to think about your NSAIDs because of the issues they can have, as far as like GI bleeding. And when people are anemic, though, they do start having this pica. They want to have a craving to eat dirt, chalk, paper, and ice. Okay. And some of the symptoms here that we have, and then they've got this very severe nail dysfunction here. And then the treatment, of course, you want to do the underlying source, and then you talk about giving iron replacement. Cytoblastic anemia, they kind of go through this a little bit. This is going to be a little bit more uncommon, and if you see this, you're probably going to be sending these folks at least for a second opinion or a consult. Okay. All right, and then we've got the aplastic anemias, which is not a good thing either. So if you see this, you're going to, definitely refer these people on if you get the call on this. They're panocytic anemias. There's a reduction in all blood cell types. So if you look at their CBC, their white cells are low, the red cells are low, the platelets are low. And that's never a good sign. So you need to refer those folks on as well. Then just a little bit more on aplastic anemia. We have one child in our practice with this. Is not a good thing. Then post-hemorrhagic anemia. And depending on, how long it is and where it is and how bad it is, you're either going to transfuse, treat with blood or with just some, to replace some volume. So you may just use some saline, that sort of thing, just depending on what's going on there. Just kind of going through some more anemias here. Then anemias can be caused from different things, autoimmune models. They've from drugs that we're taking, that sort of thing. So they can affect your red cell and your production and destruction or production. Okay. So you really shouldn't see jaundice. If you do, you better work that up. Okay. Except in babies. It's common in babies, but we definitely want to make sure it's going away, right? And we want to make sure that if we are doing a baby, that we're looking for unconjugated bilirubin, not conjugated bilirubin being increased, right? So it's talks about a little bit more about the different sorts of anemias. Okay. And some charts. You really don't need to know this so much. There is a chart in your class that kind of goes over what to see on CBCs for anemias that should be helpful to you. Okay. And then if you're looking for polycythemia, which is then too many red blood cells, you have the primary and the secondary causes of that. Polycythemia verta is the way I think that's pronounced, but I don't know, is probably the most common sort. And I do actually know several people with that. It can be very troubling for sure. Also, unless you are in a hematology practice, you are probably not going to treat that. You're going to send these folks over for for treatment. Okay, so I think that kind of goes through most of this. Of course, iron overload can cause it as well, and that can be from various different things. So, you know, some of it's just you've taken in too much, but then there can be other things there too. So this is probably, like I said, another thing. Most of this is that you just need to know about it. Some of this we can treat pretty comfortably in family practice. Some of this we probably need to refer to a hematologist or hematology practice. But you need to know to be aware of it, and you need to know how to read a CBC so you can tell what's going on there. Okay?